There's a crucial molecule in your body that helps control everything: your circulation, your energy, your stamina, your heart, even your sharpness of mind. It's called nitric oxide. But after age 40, your body makes less and less of it. Less blood flow, less stamina, less of you. But now there's N101, the nitric oxide lozenge developed by Dr. Nathan Bryan, the world's leading nitric oxide researcher backed by Nobel Prize-winning science. N101 is designed to naturally restore your body's nitric oxide levels. Just do what I do and let one dissolve in your mouth twice a day. I especially make sure to take it before workouts. N101 goes to work in minutes, releasing nitric oxide directly into your bloodstream, supporting healthy circulation, boosting oxygen delivery to your muscles and brain, helping you feel the way you're supposed to feel. More energy, better blood flow, sharper focus. Day after day. N101, it's the science of you working better. Visit HoffmanNO.com. That's HoffmanNO.com and use coupon code Hoffman10 for 10% off N101. Welcome back to today's Intelligent Medicine Podcast. I'm your host, Dr. Ronald Hoffman, and our subject is veterinary medicine, but you don't have to have a pet to derive a lot of useful information from today's podcast, because what applies to animals applies equally to humans. Dr. Judy Morgan has guided thousands of pet owners to rethink processed diets and chemical-based treatments. She shows how simple nutritional changes can yield significant benefits. We discussed that in part one. And she has received all kinds of awards and accolades, including Holistic Veteran of the Decade, and has written 9 books. She's invited to write magazine features. She also has an audience of over 500,000 engaged pet parents. And you do a podcast as well, Dr. Judy, is that correct?
I do. It's Naturally Healthy Pets.
Awesome. Okay, so that's something that's available to your website, naturalhealthypets.com. This is really exciting. And I think you in the veterinary field are really exemplifying what we in the medical field are trying to do via intelligent medicine. So what I notice is that you've got all kinds of initials after your name. Of course, there's the DVM, Doctor of Veterinary Medicine, but there's the CVA, which stands for Certified Veterinary Acupuncturist. And then there's the CP, Certified Veterinary Chiropractic Practitioner. What's up with that? I mean, you're going to stick needles in animals and they're just going to sit there and tolerate it and not bite you, or submit themselves to chiropractic manipulations?
They do, and they absolutely love it. Now, occasionally we'll get, a small, very opinionated dog. And so we know in Chinese medicine, there are 5 different elements. And so there's different personalities that go with those elements. The wood elements I'm a wood element. The wood elements tend to be a little bit cranky when we're doing things to them that they're not really that happy about. And so one of the things that we learned with acupuncture is you can put anywhere from 1 needle in to 60 needles in, depending on what you're trying to treat. So I had a Doberman. Before I had small dogs, I had very large dogs. And I had a 125-pound dog, and he had something called Wobbler's disease, which is malformation of the vertebrae in the neck. And I grabbed him by the collar to pull him back when he was getting a little too aggressive with his friend he was playing with. And when I did that, I did not realize that I had put so much pressure on his neck that the next morning he was paralyzed on all 4.
Oh my goodness. Wow.
So I've got a 125-pound paralyzed dog,
Yikes.
Which is why he was my last big dog, because I'm not a very big person. But for 5 days in a row, he had acupuncture, chiropractic, and cold laser therapy twice a day. And at the end of the 5 days, he was up running back to being his normal self. So we saw a lot of these kinds of miracles with natural treatments. But because he was down and paralyzed and you couldn't feel a whole lot of what I was doing, he got about 60 needles every time I would do his acupuncture. And a lot of times I would hook him up to electrodes, so he would be getting electrical stimulation along with it. Conversely, I had the world's ugliest dog, who was a little Chinese crested. Yes, he actually did win the world's ugliest dog. But he had, when he was younger, he had run full force, head first, into a sliding glass door. He
Hmm.
didn't see it.
Which
He hit
didn't
it
do a
so
lot for his facial appearance.
it did not, and he hit it so hard he knocked himself out. And so years later, he developed seizures. And so, from a Chinese medicine perspective, we were like, oh, he's got blood stagnation in his head, basically, a bruise inside his brain. And so I said, well, we can help this. We can use some herbal formulas, and we can also use acupuncture. Well, he was very cranky, and he said, you get one needle, lady, pick your one. And so we did manage to do acupuncture on him every week for a few weeks, just using one needle. I just picked the most important point and herbs, and we got him through it, and his seizures disappeared. So acupuncture is basically a form of energy medicine, and we're stimulating nerve endings. We're stimulating the points. If we look at them microscopically, it's where a lot of nerve input is coming in together, and also a lot of microscopic blood flow coming into that area. So when you stimulate that area, you've got a lot of things going on. You've got, electrons firing, you've got nerves firing, you've got blood flow improving. And what I found in practice, I learned chiropractic first, and then I learned acupuncture. And what I found in practice is that the two went together so well.
Hmm.
So if I did a palpation down the spine of an
You're basically
animal,
moving blocked energy and restoring natural
exactly.
connections. Yeah.
Exactly. So, you go down the spine and you find an area where there's a big knot, or there's an area where there's a big depression. And it's like, okay, well, we've got stuck energy here. How are we going to move that? Well, we can manipulate the spine, get motion back into the spine. When we put that motion in, we increase blood flow, we increase energy flow, nerve flow. Same thing happens with acupuncture. So, a lot of times I would use them together. And then when we got cold laser in our practice, we would add that on as well. Just so many things. Now we're using red light therapies, so many things that we can, it's just having so many more tools in the toolbox than here's your non-steroidal anti-inflammatory
Hmm.
pill. It's like going to the doctor and he says, go home and take 2 aspirin and call me in the morning. In our case, we go, well, you could give him an aspirin, but that's really not so great for him. So here, we're going to do these other 3 things and he'll feel great in the morning. Usually they feel great almost immediately. One of the things with doing chiropractic, you can't see all of me, but I'm about 5'3". And I have worked on very, very large horses where I had to
Wow.
stand on the top of a fence in order to be able to reach the top of their back. And people think it's a strength thing. Like, how do you have the strength to manipulate a 1,500-pound animal? It's chiropractic is not about strength. It's about speed. It's about motion, getting motion into that joint. So it's a very, very quick thrust, and it doesn't have to be a powerful thrust. So chiropractic, I actually, when I took my first course, it was accidental. I didn't know it was a chiropractic course. It was called Veterinary Orthopedic Manipulation.
Hmm.
I
Yeah.
thought I was learning about orthopedics. Yes, I was in a way, but the results that we saw in practice were really miraculous, and it could be used for almost anything, but particularly for animals with mobility issues, whether it's arthritis or lameness. Um, Chiropractic can be so powerful, but it can also help with digestive issues where things just aren't moving the way they
Hmm.
need to.
So
Things
not just
are
orthopedic problems, but also for systemic problems, internal
yeah.
organs that are
Yep.
malfunctioning.
Yep. And for the acupuncture, we use that for everything. Acupuncture is really good for allergic conditions. Just anything inflammatory. It's really good for calming things down. But it can also be very good for stimulating where things are not working. Animals that are getting weak in the hind end, or have the heart failure in dogs. That's just a lack of energy flow, lack of the energy in the heart. And so we use certain points that are going to bring energy back into that area.
Well, what's interesting about that is that critics of acupuncture and chiropractic, which are often branded forms of non-scientific medicine, or even worse, quackery, suggests that the results that we're seeing are the effects of the placebo effect. And that, so
Pretty
what's
hard to
interesting with
get a
animals,
placebo effect
yeah,
in an animal.
how do you, exactly. So how do you convince an animal that the treatment that you're giving the animal, it's not like the animal came to your clinic, plunked down 75 or $100, expects a benefit, has read up on it, and is convinced that somehow this is therapeutic. The animal doesn't know from Adam what this is going to do to them. So it really is very supportive of the notion that there is something going on energetically. Because, frankly, if anything, there would be a negative effect. Animals don't like to be probed, touched, to have needles stuck into them, and yet they still get better. So I think that that's a real
They get
validation.
more than better. I mean,
Yeah.
the very first chiropractic case I had was a 95-pound shepherd, German shepherd, who was carried in. The owner said he was walking yesterday and he can't get up this morning.
Wow.
The dog was carried in, and I went in, and my very first chiropractic case, went in, did my thing, said, I don't know if this is going to work or not. So I went to the pharmacy to get a bunch of medication for him. I look up and I see the German shepherd running down the hallway. And I went, okay. And so I looked at my technician. I said, what'd you do to the dog? She said, I didn't
Did
do
you
anything.
sub out the dogs, or it was like, is that the twin of the? No.
Exactly. I'm like, what just happened? And so, even for my staff, they were like, wait, you spent last week learning what? And I'm like, and we're going to try this. But it happened so often. My aunt had a little dog, a little tiny white Maltese thing, and it went to jump on the sofa and it missed headfirst into the arm of the sofa. And so she brings it to me. The dog can't walk. And so I hadn't told my aunt that I was doing the voodoo. And so I didn't think that she would let me do it or believe me if I said it. So I put the dog on steroids, which is what we did for neurologic problems.
Mm-hmm.
And within a week or so, the dog developed horrible side effects and developed stomach ulcers from the steroids. I said, well, we got to take the dog off the steroids. So now, let's this was very early in my holistic stuff. So I didn't have as many tools. And so I took the dog in the back of the clinic away from my aunt, and I said, all right, I'm just going to try this chiropractic thing on this dog. I'm going to see what happens. And so I did it, and I put the dog on the floor. And again, the dog runs down the hallway perfectly normally. And I went, oh, now I have to go explain. So I walked out front. My aunt's like, oh, you cured her. Thank you. What'd you do? And I'm like, I did chiropractic on your dog. She's like, that's so cool. And I'm like, well, I thought you'd think I was nuts. She said, my dog is running. You're not nuts. I said, okay, thanks.
The proof is in the pudding, for sure.
Exactly. And saw that year after year.
So let's look at some common problems that people bring animals in for. There is this thing, I don't know if you still refer to it as that, but colloquially it's called the mange. The mangy dog syndrome, with the dry skin, the dermatitis, the scratching, the itching. What's the approach to that?
So if they truly have mange, that is a mite infestation. So we need to treat that.
Okay, got to treat it. It's an infection.
So if it's an infection, we're going to treat it.
Sure.
99% of the time, it's allergies, and it's basically the body reacting to what's in the environment. So dogs, when we breathe in pollen that it bothers us, we get the runny eyes, the runny nose, the sneezing. Dogs get itchy skin. But when we look at allergy problems in our animals, one, we have to look at the diet. Like, are we feeding ultra processed food that is, just, not doing anything good for them? Are they reacting to what's in the diet? So first thing we're going to do is clean up their diet. But we know that almost all allergy problems in our animals are related to dysbiosis, which is basically a messed up microbiome in the gut. So when we're looking at allergy problems, itchiness, chronically infected ears, the licking the paws, we are always going to look at what is the gut health in these animals. And almost all of them are, depending on what they're eating, almost all of them are really pretty messed up. So one of the first things we might do is a gut microbiome test, which is really simple. Anybody can do them. They're on our website. You basically send in a poop sample and you get it back, and it says, Well, he's really a mess. We've got way too many of these bacteria, not enough of these bacteria. And when it comes back, it tells you, well, he needs more fiber in his diet, or he needs more meat in his diet. He needs less carbohydrates in his diet. And so then you can, rearrange things to support the gut health. We also do a lot of FMT, which is fecal
Oh,
microbiota transplant,
which is
which,
highly regulated in humans. It's only available
well,
for certain indications, but for animals, there's
right.
a little bit more leeway.
For animals, we have over-the-counter capsules that we can use.
Okay.
So there's a company called Legacy Biome,
Mhm.
and the capsules from Legacy Biome, we have them for dogs and cats. They come from dogs that are 7 generations of unvaccinated, no medications
Hmm.
used, well-fed dogs. So it's one colony. They live a very natural life
Healthy
and
donors.
healthy donors. And so I decided I would do a test on my dogs. My dogs are well fed, don't have issues. So I took what I think is my healthiest dog, never has a GI issue, and I did the microbiome test on her. It came back beautiful. It comes back in either the green, yellow, or red. Comes
Hmm.
back with everything in the green, but when I looked at it closely, it said that the fungal diversity in her microbiome was not as good as it could be.
Okay.
And there were antibiotic resistant bacteria that were picked up. And
Oh.
I said, okay, this dog doesn't take antibiotics. Why do I have antibiotic resistant bacteria? She's on a great diet. So I said, all right, I'm going to give her a month of the FMT. I'm going to retest and just see what it does. So this is my healthy dog.
This is just to
Do
optimize, right?
Yeah,
Yeah.
just to optimize. And so we did the month of FMT, which is putting a capsule in her food once a day. At the end of 30 days, retested. Her fungal elements were very diverse, that had completely cleared up, and every single antibiotic resistant bacteria was gone.
Hmm.
So even in a healthy animal, you can do better.
Yeah.
And so that was just my own little test. I'm like, because I can, I'm just going to do this. So for my own dogs, if they have to go in for a procedure, like I had one, he had glaucoma, he had to have an eye removed. So of course, when they're there, they're getting a lot of anesthetics, they're getting pain meds, they're, all kinds of things going on if they're in for any kind of surgery. So whether it's a spay, a neuter, a dental procedure, anything, all of those drugs are going to cause
Yeah.
an upset in the
Sure.
microbiome. And so then a lot of times after that, we see, oh, they're itching more. Oh, they developed an
Hmm.
ear infection. They've never had that before.
Hmm.
And so a lot of times first of all, we detox them from all that stuff. So it's like, all right, I'm going to do a liver cleanse. I'm going to use some milk thistle and some dandelion, and we're going to clean that up. And then we're going to do that FMT because we want to get them back to that level of having a very healthy microbiome. So in veterinary medicine, unfortunately, we spend a lot of time wrecking the microbiome. And so there's a microbiome in the lungs, on the skin,
Hmm.
in the ears, in the bladder, in the gut. And when we look at the shampoos that we're told to use, they've got chlorhexidine, they've got
Yeah.
ketoconazole. They're killing all of the
Mhm.
good microbes that are on the skin. We don't want to do that. We don't want to keep using antibiotics and killing off everything. So all the ear medications that are prescribed for our pets, they almost all of them have an antibiotic, an antifungal, and a steroid in them. Well, there's no way you have a good microbiome left after you do all of that.
Yeah.
And so we want to look at replacing the good guys instead of always trying to kill them off. And that's why when we use medications, a lot of times, like the ear infection went away on the medication, and then 2 weeks later, it's back again. Well, we haven't gotten rid of the underlying cause. And if the underlying cause is a disrupted microbiome or an intolerance to something in the diet, a lot of the yeast infections that we see in our pets, whether it's yeast on the skin, yeast in the ears, it's because we're feeding them these high carbohydrate diets. Carbohydrates break down to sugar,
Sure.
sugar feeds yeast. And that's not what they're meant to eat. So, anybody who's dealing with those issues, the first thing I'd say is let's get all these starches out of their diets. Let's get them on something that's more species appropriate. Let's look at their microbiome. And 9 times, this is why being a holistic practitioner, when we look at things this way and we say, okay, first thing we're going to do is we're going to change their diet, we're going to clean it up, we're going to get rid of all these starches and things that they're not meant to eat. And then they come back in 2 or 3 weeks and they look like a new animal. They're feeling better. All of that stuff is cleared up and you look like a genius. And really it was, oh, I fed you a species appropriate diet. And then we start to fine tune things. So I had a client that came in with this huge, like 120-pound shepherd, beautiful dog. But for years, he had been dealing with skin allergies, itching with this dog, hot spots, gooey, moist, chewing areas on its skin. And he had been to the university. He had been to multiple dermatologists, and they kept putting the dog on immune suppressant drugs.
Yeah, powerful.
So
we have these monoclonal antibodies now.
yes. And so the monoclonal antibody injections against the IL-31 cytokine for itching, and then also immune suppressant drugs to, basically we stop the itch, but we don't solve the underlying problem. We're actually making it worse. And so this guy came to me and he had spent thousands of dollars and his dog was on all these immunosuppressants. And I said, well, I can make this better. And I said, we're going to have to do a diet change. And we actually put that dog, the guy went crazy. He was not happy with me, but he did it and it worked. I put the dog on a raw milk diet for 30 days. And I wanted to put it on just a raw goat milk diet, but goat milk is not near as high in fat as cow milk is. And this was a 125-pound dog, so it was going to have to drink
this is
so
an
much
elimination
goat milk.
diet. In other words, just a
It was an
mono
elimination
diet, so on one specific food.
One thing, and the reason we go with raw milk is it has natural enzymes, it has natural probiotics, it has all the vitamins and minerals. Like, it is a diet that supports you. It is a complete diet. And so the guy was actually, my practice was in New Jersey at the time. And so we were near Amish country in Pennsylvania. And so every week he would drive up to Amish country and get enough raw milk. We did a combination of goat and cow milk, A2 milk. And he would go up and he would get enough for the week. And after 30 days, this dog's coat was beautiful. Its weight was perfect. It was very active, but it would occasionally scratch. And he said, you didn't make it 100%. And I'm like, are you kidding me?
Yeah.
Like, your dog is 97% better. He doesn't have hot spots. He's not scratching. And he was very upset at the cost of all this milk. And I said, well, how much did you just spend on the dermatologist? How much were you spending on all of the drugs? And, you're not buying dog food, you're buying milk. So let's just do a spreadsheet and then come back to me and we'll look at it. And eventually we did get the dog on a whole food diet and not just the raw milk diet, but it worked beautifully. We don't do that with all of them, but this dog, his immune system was so suppressed and things had been done for so long to make things a mess. I'm like, well, we have to make it better. And this is how we're going to make it better. And it worked.
Okay, folks, at this point, let's pause and allow one of our sponsors an opportunity to share an important message with you. So here goes. Listen up.
Has your digestive health been striking out due to poor food choices, medications, stress, and other lifestyle issues? This season, hit a home run for your digestive health with Dr. Ohhira's Probiotics. Dr. Ohhira's Probiotics is a live probiotic encapsulated in small, easy-to-swallow capsules that delivers Dr. Ohhira's signature blend of pre, pro, and postbiotics. Dr. Ohhira's award-winning formula contains a prebiotic blend of fruits and vegetables, which are naturally fermented with 13 strains of live probiotic bacteria for a minimum of 3 years. The result? Dr. Ohhira's game-changing postbiotic metabolites, which are key to supporting long-term digestive, immune, and cognitive function. Dr. Ohhira's Probiotics, an all-star formulation and the best probiotic on the market today for overall digestive health and wellness. Dr. Ohhira's Probiotics, available at Sprouts, Natural Grocers, and other natural health retailers nationwide.
Thanks for listening, and thanks for supporting our sponsors. They are what make intelligent medicine a free continuing resource to you. And now back to today's guest, integrative veterinarian, Dr. Judy Morgan. What about omega-3 fatty acids for skin problems?
Amazing.
Yeah.
So omegas are, so part of the problem with the ultra-processed food, the omega-6 to 3 ratio is completely backwards. So we wanted omega-6 to 3 of less than 5 to 1. The closer you get to 1 to 1, the better. But ultra-processed food is going to be about 30 to 1. So way too many omega-6s, which are highly
Pro-inflammatory.
inflammatory. So even my dogs are on very low ratio diets, and I still add omega-3s. I add a fish oil to their diet, and that's because my dogs are prone to heart disease. And they also have neurologic problems that are common in that breed. So I'm like, well, let's see, brain health, heart health. Oh, that would be omega-3s.
But also skin
Load you
health.
up.
Clearly,
And
there's
skin health. I
Sure.
don't have skin issues with my dogs because they're on really, really clean diets. And we don't over vaccinate, and all the things that contribute to so many allergy problems. So we just don't deal with that. We don't deal with inflammatory bowel disease. We don't deal with allergies. We don't deal with arthritis because of what they're fed. So it really does start with the diet. And that's why I tell people all the time, even if you are feeding an ultra processed food, what can you add to that bowl to make the food healthier? I mean, obviously, I'd love everybody to get off the ultra processed food, but if you just added eggs, sardines, blueberries, mushrooms, dark leafy greens that are steamed, all of those things are superfoods for your pets. You'll see a difference, even if you stick with the ultra processed food, which again, not recommended. But even if you have to, you think you do for whatever reason, if you can add some of those fresh foods to the bowl, you'll see a difference just with that.
So I noticed looking at your products at naturallyhealthypets.com, there's a whole lot of products, literally dozens and scores of products. That a lot of the products that address pain contain an ingredient called PEA. You seem to be a big fan of PEA, and we've talked to some human experts who deal with pain who also like PEA. Tell us about that.
So PEA stands for palmitoyl ethanolamide. And I originally got turned on to it because of the breed of dog that I have. They're prone to a neurologic problem called syringomyelia, where they basically have these fluid pockets in their spinal cord. They have some spinal cord deformities and abnormalities, and it's extremely painful. And so from a traditional standpoint—
But it's nerve pain, which is not so much like joint pain. Joint pain is inflammatory, the synovial membrane.
Exactly.
But nerve pain is very hard to address.
Right. And so these dogs are put on gabapentin all the time. And if gabapentin doesn't work, then we move up to pregabalin and tramadol. And so they're put on. And when I first started adopting this breed, they were all on those drugs. And then I was reading and found that PEA can be very, very good for decreasing pain for these dogs. So I said, okay, we're going to give it a try. And I could only find a human product in this country. So I bought the human product, started my dogs on it, went, oh my gosh, this is great. And I was able to take them off all of the drugs.
Wow.
So then we started researching, what else does PEA do? And PEA has been researched heavily since about the 1950s. So there are thousands and thousands of papers, and they've looked at it for a lot of different things. So it's been looked at for pulmonary fibrosis, which we do see in certain breeds of dogs. It's been looked at for joint pain. It has been looked at for all different kinds of inflammation and for nerve pain, and for inflammatory problems like allergies and arthritis and all the different inflammatory bowel disease. So we ended up, the problem with the human product that we were able to get, it's in capsules, which is fine, except that it has rice powder as a flow agent in there. And we get a lot of dogs who have allergic reactions, and the PEA is supposed to be helping decrease the allergic reactions, and they were reacting, and we said, it must be the rice flour that's in here. So we finally were able to find a pure source of PEA from the Netherlands. So it's human grade. It's made for people. We're labeling it for pets. And we've had some, anecdotal, amazing stories from people, but there is tons and tons of research to back it up. Again, I'm not allowed to say PEA
Yep.
cures this, that, and the other
Yep.
thing.
No.
But when we look at the research papers that are out there, I will say that all of my dogs take it. I have one cat who's taking it. She has a meningitis. I have a donkey on it, two miniature horses on it, and all the people in my family on it.
As yours truly as well. I take PEA as well.
There you go.
So, what about behavioral problems? Because there are behavioral problems among animals. Animals that are skittish, animals that are, kind of whacked out, obsessive behaviors. Especially around. They may have PTSD of the animal variety. They need to be calmed when 4th of July comes along. And you mentioned PEA, which, by the way, is a cannabinoid.
Mm-hmm.
Do you believe in CBD for animals? Is that something that can be used?
Love CBD. So one of our dogs had a seizure last night, and I was not home. My mother called me. She's 89. She lives with us, and she's pet sitting, and she says, "Gilly's having a seizure." I said, "There's CBD in the cabinet. Go get it." And she gave it to him. She said he went to sleep. He slept all night. But we use CBD a lot. I am not allowed to sell CBD. It's just these very weird rules about who can and cannot sell CBD, but we have CBD products that we recommend. We have affiliate links on the website. We use CBD for a lot of things. Again, we have horses, a donkey, the dog. We use CBD a lot. My husband is on CBD. It has been used for a lot of different things. And I will say that as far as behavioral problems, we also use flower essences. We also use food therapy. There's a lot that can be done for behavior problems. The neurotoxic pesticides that we're giving are causing a lot of behavior problems. Actually, next month, I am speaking to the Working Police Dog Association.
Good for you.
Which I was invited to speak, which is kind of funny because I'm really not a German Shepherd person. I'm kind of scared of them. I think it's funny that I'm speaking to them, but I was asked to speak because these dogs, that so much training goes into them, and the main trainer tells
it's
people
a huge sunk cost investment.
Huge.
So they have to keep some longevity and well-being in those animals.
So they actually are supposed to sign they do sign a contract that says they will not give any of these neurotoxic pesticides to the dogs for flea and tick prevention. And they've had a couple where the veterinarians convince the owners or the handlers that, no, these are fine, go ahead, no problems. And the dogs have developed huge behavior problems, like out of their minds, crazy.
Wow.
And so they're brought back to be retrained. And they said, these dogs are literally out of their minds, and they usually end up getting put down because they're not retrainable, because their brains have been scrambled. So that's why I got invited to speak. They're like, we need you to come up here and talk about natural, options and why we should not give these and why this is so dangerous.
What are some of the natural options for flea and tick prevention? Because these flea collars and sprays are ubiquitous, and people use them.
And extremely problematic. And some are regulated by EPA, some are regulated by FDA. Like, it's all over the place, crazy. And so I don't use any chemicals on our farm. For our barn cats who can't wear collars or tags, or they don't like being sprayed, I'm not going to wash them. I have a powder that I use on them that is neem, yarrow, and diatomaceous earth. Yep. So literally sprinkle it in my hand, pet the cat. It's very easy. For what most people don't realize is that fleas and ticks, 95% of the life cycle is spent in the environment, not on your pet. So when we go crazy treating our pets, and most of the products that we use on our pets don't repel, so the fleas and ticks have to bite your pet in order to get the chemical and die. So that's not really all that helpful. So what we want to do is keep the pests from getting on our dogs and cats. So we would need to treat the environment. If you have a yard that they go in, you can spray it with essential oils. My sister lives in Massachusetts. She has cedar oil sprayed on her yard throughout the season.
Cedar is a pretty good insecticide.
It's very good. You can use cedar, you can use peppermint, you can use lemongrass. There's a lot of different things you can use. You can also use diatomaceous earth. on your yard, you can use that in the house. You can use beneficial nematodes, which are little tiny bugs that you spray on the
Hmm.
yard that keep fleas and ticks from maturing
Hmm.
to adults. So if you don't have any adults, then they can't bite your pets. So we do a multi-layer approach for my dogs. I'm putting a powder in their food that has neem and garlic and B vitamins, things that make them not so tasty and they don't
So
smell
it
so
sort of
good.
exudes through the skin and acts as kind of a
Exactly.
natural repellent.
Exactly. Meanwhile, they don't smell bad to me at
Yeah.
all. If we're going outside to walk somewhere where there might be a problem, then I use a pet safe essential oil spray on them. They also wear a tag. The one that they're wearing right now is called Fleas Gone, which is a scalar wave tag. We also have an ultrasonic tag called
Hmm.
Tickless.
Hmm.
Tickless is very cool because they also have one for people that you can put on your sneaker. They have a Tickless Mini that you can put in your house.
Wow, I didn't know that.
Yeah. So there's, basically we need if you live in the South where, if you're in Texas, Florida, Mississippi, it never gets cold. It's moist. It's perfect conditions for these pests. And so you're going to need that multi-layered approach. So, probably treating your yard, putting something in their food, putting something on them, and then, don't forget something really simple like a flea comb. It has very, very, very fine teeth. And
Hmm.
so you comb through. One adult flea can lay a couple thousand eggs. Our house in New Jersey got infested once because my daughter brought in her new kitten that she adopted off Craigslist and came for Thanksgiving and left us with a house full of fleas.
Yeah,
And of
that's a
course,
bummer.
it was November. I wasn't layering anything on.
Hmm.
So I did my usual, okay, everybody gets washed. All the bedding gets washed in hot water, vacuum, 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 vacuum. And I did this week after week. And, 4 or 5 weeks in, I'm like, why do I still have fleas? And so the house cleaner came and I said, we are ripping this house apart. We are finding the source of these fleas. We moved every piece of furniture and under one rocker recliner in the family room, when we flipped it upside down, there was a big ball of hair under there with a whole nest of fleas.
Yeah.
And I hadn't found that source in my week after week after week. And when we finally found that source, problem solved. So 9 times out of 10, people are missing
Hmm.
something. So if you have a crawl space
Hmm.
or a basement, you got to treat that area. They love to go crazy in there. Anywhere where mice, squirrels, bunnies hang out, that's where they all love to
Hmm.
hang out.
Hmm.
So it's really being thorough, like my barn cats. Obviously, I can't treat my barn. I can't treat the 23
Yeah.
acre farm. So they get powder put on them once a week. Okay,
Hmm.
that's great. But the other thing is, the healthier your pet is, the healthier their immune system is, the less attractive they
Yeah.
are. My barn cats, if I find 2 ticks a year between 7 cats,
Hmm.
that's a lot. They don't taste good. They're
Yeah.
too healthy. When I would see people would come in that have 10 cats, they bring all
Mhm.
10 cats in for their annual exam. And you've got the young, robust, fat, healthy cats, you might find a flea on them.
Yeah.
And
That's
then
sort
by
of
the
like
time you
a rolling stone gathers no moss kind of theory.
Exactly. And you work your way down to the 18-year-old cat that's got kidney disease, who's skinny and has a rough coat, and they have
Very
4,000 fleas on
susceptible.
them.
Yeah, it's the
Yeah.
terrain that has a lot to do with
Yep.
it. Wow, you
Yep.
you really exemplify a lot of the wonderful principles of integrative and natural medicine when it comes to animals. And I think that this is an important take-home lesson for our listeners who are interested in human health. Also, certainly for pet owners, you're a great resource. The website is naturallyhealthypets.com. And I think we barely touched upon some of the innovative approaches that you have for animal maladies. And so I refer people to your website, naturallyhealthypets.com, and to your podcast. How often do you do your podcast?
It runs every 2 weeks.
Every couple of weeks. So you're um, laying out pearls of wisdom for pet owners on a regular basis, and there's a repository of that at naturallyhealthypets.com. Also, a great lineup of products, some of which you formulated, some of which you outsource. So there's really a lot of wisdom there. Wow, when this was a cold call. Your publicist got in touch with me and said, Dr. Judy Morgan is great. Would you put her on? I said, well, yeah, let's do a thing on pets. I kind of moderated my expectations, but I have to say you've vastly outperformed. You just knocked it out of the park with your wisdom, your experience, your innovative spirit, your willingness to explore different modalities when it comes to animal health. And it's very, very important that you do that because the solutions available to animals, there's a lot lacking, and there's a lot of, I think, damage that we're doing to our pets and to our environment through the wrong kind of foods, but also overzealous veterinary care that is not in their ultimately in the interest of their health. And really, that's also in the spirit of intelligent medicine. We want the best of high-tech medicine, but we also want to avoid some of its pitfalls. So great stuff, Dr. Judy Morgan. I really appreciate you joining us today. And all the best
Thank
to you.
And we do have a code Intelligent50 for 50% off of any of my books on naturallyhealthypets.com.
Wow, fantastic. Okay, thanks for setting it up for our listeners. Say it again.
Intelligent50. Use that code on naturallyhealthypets.com and you can get 50% off any of the books that I have written.
There's like in the menu, there's a place where you can put in a coupon code. Fantastic. Thank you so much for doing that. That's Dr. Judy Morgan, and I'm Dr. Ronald Hoffman. This is the Intelligent Medicine Podcast. I want to thank you for listening to the Intelligent Medicine Podcast. Follow us on Apple Podcasts, Spotify, Amazon Music, or your favorite podcast app, and get new episodes automatically downloaded every weekday. And please give us a rating and review. It truly helps new people discover intelligent medicine. The Intelligent Medicine Podcast is for general informational purposes only and does not constitute the practice of medicine, nursing, or other professional healthcare services, including the giving of medical advice, and no doctor-patient relationship is formed. The use of information on this podcast or materials linked from this podcast is at the user's own risk. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Users should not disregard or delay in obtaining medical advice for any medical condition they may have and should seek the assistance of their healthcare professionals for any such conditions. Finally, please visit drhoffman.com and discover everything intelligent medicine has to offer, including frequently updated, unbiased health news and fully vetted product and supplement recommendations. You're listening to Intelligent Medicine, a resource to help you take control of your health. We offer a balanced, objective analysis of all your health, wellness, and aging options, both conventional and alternative. Now you can take your engagement to the next level by joining FullScript. FullScript is my online dispensing platform that only offers curated, professional-grade supplement brands that I know and trust. Never counterfeit or expired, always stored and shipped correctly. Just go to drhoffmanstore.com for more information and to start your free FullScript account. Buying through FullScript offers fast, free shipping, optional refill reminders, a mobile-friendly site. It's safe, secure, and HIPAA compliant and offers world-class support. Just go to drhoffmanstore.com. You'll get access to the supplements and features you need to help you achieve your wellness goals, including my custom targeted protocols that combine the products I recommend to address specific needs, heart health, immune support, and much more. It's all at drhoffmanstore.com. drhoffmanstore.com.